I'm Dr. Tanya Parich here at the Parich Eye Center and wanted to take a moment to speak to you today about eyelids and eyelid surgery. I do different types of eyelid surgery, whether it's for excess skin, for the eyelid hanging down covering the pupil, whether it's the eyebrow coming down from the sides. Those can be considered functional, which is covered by your medical insurance, or cosmetic, where it would be an out-of-pocket expense to the patient because it's not quite bad enough to be covered by your medical insurance. With this surgery, we can do it with a scalpel, or you can do an upgrade where we do it with a laser, which cuts and coagulates at the same time. This is a CO2 laser, which is my favorite, one of our specialties here at the Parich Eye Center. So the laser cuts and coagulates at the same time, resulting in a much faster healing process and less bruising and bleeding, both during the surgery and therefore faster recovery after. If you choose to have the upper eyelids done, you can consider having additional add-ons, such as a brow pexy, where we do a cosmetic add-on to lift the brow, a permanent stitch on each side, or sometimes 2 stitches on each side, to permanently anchor the eyebrow on the orbital rim, replacing it to its correct anatomical position. So that will give you longer lasting results with your upper eyelid surgery, which can be medical or cosmetic. We can also do things where we take off some of the extra fat pads if you have a lot of herniated fat pad, usually seen as a bulge here and here. We can also do a lower lid blepharoplasty, where there's excess skin or puffiness beneath the eyes, going through the lower lid, making an incision on the inside so no scar on the exterior, using the laser to shrink the fat pads on the inside. Eyelid surgery is considered a major surgery in terms of the fact that you do have to have medical clearance by your primary care doctor, and you must stop all blood thinners at least 2 weeks prior. This also includes other supplements like garlic, vitamin E, ginkgo biloba. We basically ask that you stop all vitamins prior to any sort of eyelid or skin resurfacing procedure. Of the different types, you have to be evaluated by your surgeon to consider whether or not your insurance will cover that. Basically, all insurances have the same requirements, where it has to cover a certain amount of your peripheral vision, which we do a visual field test to consider whether or not you qualify for that type of surgery covered by your insurance. If you have any questions, whether it's cosmetic or medical, call our office today and book your appointment. We can see you and consider if it's medical or cosmetic and help you with your needs.